Well, it's that time of year again where a lot of people really start getting serious about fitness and exercise. Maybe your doctor has said, you know what, you should start moving. We are in the physical therapy clinic here at Sports Club, part of a great service from secours. Say hello to Scott Carley. You're one of the PTs here. How's it going?
Great. Thank you for having me.
Thank you for letting us kind of come inside, part of the gym and talk about this great program that you guys are offering. It's called PrEP. Explain to me what that is.
That's right. So secours is kind of taking the existing PrEP program, which is a physician-referred exercise program, and running with it. Since we know that we're kind of a major hospital system here in the area, we think we can play a larger role in the proactive part of our health and wellness of our community. So what it is, it's a 60-day program here at Sports Club Congaree. We're hoping to spread that to some of the other sports club gyms, but we're going to start it here. And for $60, it covers you for 60 days.
I said $1 a day, guys, just in case you're not good at math. $1 a day.
Very affordable.
Yeah.
It includes one session with a physical therapist, just to kind of screen, make sure that they're appropriate to start this program. We follow up with that same person at day 30 and at day 60. Included is a full membership to Sports Club, so you can come 7 days a week if you want.
That's huge.
Yes, you can attend their classes. They have classes for all sorts of abilities and what your goal is. And it also includes a weekly session with the personal trainer. So to me, you can't beat it.
I mean, first of all, just to get the membership to Sports Club for that is great.
Absolutely.
Then to have access to the personal trainer, because sometimes that's what you need. You need someone that you can be accountable to.
Yes, we love that it's a little bit more of a medical umbrella over just sending somebody to a gym and crossing your fingers and saying, I hope you figure it out. So not only is the PT there to make sure that there's no joint pain, there's no issues that maybe they need to see a physical therapist first before they just start hitting the gym, but they also have that weekly session with the trainer. So the program is fairly standard for each client, but highly customizable. So the physical therapist can help direct. The personal trainer may say, oh, if you have issues with this, or maybe your knee is kind of giving you issues, they can make sure that you're reaching your own personal goals throughout the whole 60 days.
So I love that. So on day one, when I come in to see you, we'll probably do, like you said, like a balance test. You're going to do a few things.
Yeah, we kind of screen. We can take those essential vitals, heart rate, blood pressure, make sure that we're safe there. Most of the time, if they're already referred to us, they've already passed those big medical tests, but we can go ahead and make sure that there's no red flags. We'll look at kind of gross, just muscle strength, joint pain, make sure that everyone is safe to proceed. And then you're right, we can look at balance. There's all sorts of things we can look at depending on what that client says coming into us on that first day.
And who would be a client? Obviously, it's in the name, PrEP, so it's like a referral. Let's talk, I guess, first, why would a doctor refer a patient to you?
Yep, great question. We've found that a lot of these issues that patients typically go in our traditional healthcare, right? You have pain or you have an issue, diabetes or you're overweight, you go to the doctor, and sure, the doctor can help and prescribe some medicine, but we found that exercise is such a great prescription, such a great medicine. And so someone who's looking perhaps just to lose some weight or to get in better shape, it can help the cardiovascular system, the lung system, your joints, all sorts of things. So the benefits of health and of exercise are, endless.
So endless. And it seems kind of funny because people sitting at home right now being like, but my knees, they give me such trouble. You're telling me it hurts to move, but I should move.
Right, yeah.
Because it will actually make you feel better.
Absolutely, yeah. I think that's a common misconception is if your joints hurt, let's say you have knee pain, you don't need to move. And really movement is great for a joint. Now, I think that's why it's important that we get to triage through a physical therapist. And so again, that PT who's been trained for many years, we can make sure that you are safe and that you are good to proceed to that next stage.
Okay, so if you're watching right now and you're like, may as well make it part of the resolution, let's get going. They need to be referred from their doctor or nurse practitioner?
Yeah, they can be referred by a physician, nurse practitioner, physician's assistant, or your physical therapist can also refer to the PrEP program.
Because that's a good thing too. If you're, at home, you're like, well, I am kind of active, but, I'm nursing an ankle injury or, rotate or whatever.
That's right. Absolutely. I think you go through several stages. When you see your doctor, obviously they're going to screen you, make sure you're appropriate, but also when you see us that day 1 and day 30, we're going to make sure that you're not only ready for the program, but let's say halfway through that you're making progress. If you're not making progress, or let's say something comes up, we can make sure that you're finding the right person with all the resources we have in the entire Bon Secours health system.
What a great combo. Bon Secours right here in Sports Club.
Yeah.
I love it. Thank you so much.
Thank
this
you.
This is very cool. Again, if you're interested in this, talk with your doctor. Give Scott a call. You can find all the information right there on your screen. So thank you, Scott.
Thank you.